in several schools across the metro, either out or virtual today due to mass sick calls. Flu levels above baseline here in Oklahoma. And for more on what families need to look out for, let's go ahead and welcome in Dr. Catherine Mims. Dr. Mims, thank you so much for coming in. This is an important topic. We definitely want to talk to you today.
Yes, very busy time for us right now.
So tell me, what have you been seeing this week?
Yeah, the hospitalization rates statewide, but particularly at OU, both in our adult tower and children's, have been extremely high, primarily from flu, much higher than our 10-year averages at this time from flu. We are very busy. Our ERs are maxed out, and we probably I think we saw the most number of patients in our ER at children's yesterday.
Wow.
So it's been busy.
Let's talk about the numbers here. When it comes to flu tests, we've seen 34% of all tests taken are coming back positive. Yep. We're also seeing more than 500 flu hospitalizations here in the state. Are those numbers shocking to you, or are these normal for this time of year?
They're shocking in the sense of it is absolutely not normal for this time of year. Now, flu A in particular does seem to rise at this time of year, but we're right at the top end of our 10-year highest average. But the hospitalizations are what has been really shocking. I mean, quite a bit above any year in the last 10 years. So let's go ahead and talk about causes of spread, because again, we've seen several school districts go ahead and cancel class or turn to virtual learning. We've seen offices have several sick calls. So just what are the causes of spread like this? Yeah, so unfortunately, flu is spread anytime you cough, sneeze, blow your nose, and then also obviously by touch, so lots of hand washing, try to catch your cough in your elbow, that sorts of thing. But flu A is just very contagious.
Very contagious, and I do want to ask about families. What should they be looking out for right now? For those families that might have a healthy kiddo right now, in order to keep them healthy, what should they be doing?
Yeah, so what you want to look out for is primarily cold symptoms, runny nose, cough, cold, congestion, sort of things, but also fever. We've seen quite a bit of fever, dehydration, and even some viral GI symptoms like vomiting and diarrhea. In order to keep yourself healthy, if you have any sick symptoms whatsoever, try to kind of isolate on some level, maybe don't go to school that day, but hand washing, wear a mask, get a good sleep, and eat a varied diet.
And Dr. Mims, I do want to ask as well, for those that are sick right now and they've been treating themselves with over-the-counter medicine and it's just not working, at what point should they call their physician, or what point should they go to an urgent care?
So thankfully, flu does get better on its own traditionally without any antibiotics. That being said, we do have a medication, Tamiflu or Xofluza, that works well, and it actually is working remarkably well for flu A this year. So if you're feeling particularly ill, high fevers, unable to maintain hydration, that's the time to go and get seen, because the medications only work within the first 72 hours. Otherwise, if you can stay at home, that's probably the best thing to do, and keep yourself isolated. But any shortness of breath, feeling, struggling, not able to maintain hydration, go see your doctor.
Absolutely, and we've been talking about the flu, but I did want to ask about any other winter illnesses that y'all been seeing.
Yeah, so towards the end of December, we saw a pretty significant rise in RSV. It is still rising, but not nearly as high as influenza. And COVID had risen there at the end of December, but has now sort of stabled out and become a little bit low. So those are the ones that we're really keeping our eyes on. And then avian flu is obviously always in the back of our mind, and we've been working with the health department to keep an eye out for that.
Well, Dr. Mims, you've been incredibly busy, and we are incredibly thankful for the work that you all do over there at OU Health. One last question, one last recap for people who are just tuning in right now. What should they be doing right now to keep themselves and their family safe?
Hand washing, avoid anyone with cold symptoms, stay home if you have them, get your flu shot.
All right, Dr. Mims, thank you again for taking the time. We really appreciate it.
Absolutely.
All right.